Hi all, Michelle Giannato here, patient advocate and Vice President of auto-brewery syndrome information and research. Reminder, I was married to a man whose body converted carbs to alcohol. In my last video, I highlighted how the medical condition started. He had surgery, followed by a post-op infection, and then he developed all these symptoms and a seizure. No one could really explain what had happened. There was no medical reason for this that any medical professional could find after a battery of tests. I think I had explained this was in November of 2015. About a month later, he had another seizure on Christmas Eve, and he was rushed to the hospital and went to the ER. They admitted him, and he was visited by a battery of doctors that did all kinds of tests. And since we had mentioned that there was a seizure a month prior, they brought in neurology. They started doing tests for seizures, and after a few tests, they came up with, there's nothing wrong, right? But they did diagnose him with a seizure disorder, or they wanted to give him medication for a seizure disorder. And I said, no way. We've been struggling for 2-3 months now with these weirdo symptoms that no doctor could figure out what was going on. And the last thing I needed to do was add more medication to his already building list, because we didn't have a firm diagnosis of what was going on. We had a number of doctors that would come in and try to understand, the symptoms that we've been, explaining, and the test results and the blood tests and the other tests that he's been given. And there was no conclusive evidence that would point to a particular diagnosis. I had spoken to my stepfather at the time because we couldn't understand what's going on. Someone else had mentioned when they walked into the hospital room, alcohol withdrawal. And I said, okay, again, we're back to this alcohol withdrawal, but if he's been in bed for days and having these symptoms and there was no consumption, how does his body go through alcohol withdrawal? This is a thing that we were chasing. So I called my stepfather and I had asked him, I said, look, this word came up again, alcohol withdrawal. Did you ever hear of anything like this? And he said, yeah, I did hear of something. It's called ABS. Bring it up to the doctor. Let them look into it. And I said, well, what is this ABS thing? And he said, well, it's a condition, very rare, where a person's body makes alcohol. And I said, wow, all right, well, let me go into the nurse's desk and talk to them. So I hung up with my stepfather. I walked over to the nurse's desk and I said, hey, I'd like to speak to the doctor that's treating, at the time, my fiance. And the doctor happened to be standing there, and he said, what do you have? And I said, well, my stepfather works in medicine. He's not a doctor, but he gave me this ABS. It stands for auto-brewery syndrome. It's where your body makes alcohol. And is this possible? Why we keep coming up with this alcohol withdrawal? Is this something we could look into? I was quickly dismissed. The doctor said, no, only children have that disease, and it's very rare. They haven't seen any cases in the United States. And I was confused because I said, well, wait a minute. This is a number of times he's been in the hospital. Alcohol withdrawal keeps coming up. I have a possibility here. Can't we just look into this? And I was told no. So that's kind of where we were left. So I went back to the room, and we, again, over the next couple of days, we were visited by a multitude of doctors. They were looking at blood test results, CAT scans, chest scans, you name it, they were doing it. And again, they couldn't come up with a diagnosis. So he was released from the hospital, and we were told, if this happens again, have him come back. If you would like to read up on auto-brewery syndrome, our website is auto-brewery.org. We encourage you to watch the videos, look at the news stories, the articles, download the case studies. This is a real disease, and it's not rare. It's rarely diagnosed. Thank you, and tune in to my next video.